Thank you very much and good afternoon. So for today, December 2nd, we have 834 new cases to report of COVID-19 in the province, 3 of whom are epidemiologically linked cases, bringing our total number of cases in British Columbia to 34,728 people. That includes 174 people in the Vancouver Coastal Health Region, 529 people in Fraser Health Region today, 20 people on Vancouver Island Health, 66 people in the Interior Health Region, and 45 people in Northern Health. We now have 8,941 active cases across the province, of whom 337 are in hospital, 79 of whom are in critical care or ICU. We have 12 new deaths to report today, bringing the total number of people who've died from COVID-19 in BC to 469. And my heartfelt condolences go out to the families who have lost loved ones again today, and to their care providers, and to their communities. We mourn with you. We have 10,201 people under active public health monitoring around the province, and 24,424 people who have recovered from COVID-19. There are 3 new healthcare facility outbreaks at Royal City Manor in Fraser Health Region, at the Saanich Peninsula Hospital in Vancouver Island, and the West Coast General Hospital in Port Alberni on Vancouver Island. In addition, we have 3 long-term care outbreaks that have been declared over at Cottage Worthington Pavilion, Discovery Harbour Centre and Orchard Manor, and at 2 acute care units where outbreaks have resolved at the Burnaby Hospital 3C and Langley Memorial Hospital 4SC. That leaves us with 54 active outbreaks in long-term care and assisted living, and 7 in acute care, in that both hospitals have other units that are still active. Our active cases in long-term care are 1,472, 926 residents, and 536 staff. In addition, there have been 2 new community outbreaks at the Cove Shelter in Fraser Health, and also Millennium Pacific greenhouses, where we have a number of workers who have been affected by COVID-19 in both of those areas, and Fraser Health is leading the response and the outbreak response in both of those communities. Today, you may have heard the United Kingdom has approved the first vaccine outside of China and Russia, the Pfizer vaccine, the COVID vaccine for use in people, and I know that other nations, including Canada, will be following, hopefully sooner rather than later. And this is, of course, very exciting news for all of us. This is part of the solution to what we are going through, but it is going to be some time yet before we get there. It is, however, clear evidence that we do have light ahead. And in BC, we are working very hard to put together our immunization strategy for everybody across the province who wants to be immunized. And we are ready to provide it. We will be ready to provide it to the high priority populations as soon as vaccine is available for us here in BC. And we're working, as you know, with Dr. Ross Brown, myself, and our team at BC CDC and across the health authorities to make sure that we are ready as soon as vaccine is approved for use in this country. So that is exciting news for all of us. I recognize as well that this virus, COVID-19, is taking a toll on all of us, and this pandemic has been relentless for the last 10 months. And after many months of restrictions on who we can see and where we can go and what we can do, we are all feeling that fatigue. I know many, many people are doing all they can to make sure that we can help each other to get through this COVID response. Yet I'm asking you all to continue and to do a little bit more, to do our part to slow the spread in our communities, in our families, in our loved ones, in our workplaces, until vaccines are available for all of us. Most importantly, to protect those who are most at risk, particularly our seniors and elders. And we hope and expect that vaccines will be ready in the next few weeks. But this virus continues to move and move quickly between us, and it takes lives. Another 12 families have been affected today. And we are continuing to see unchecked transmission in many places despite our efforts of public health teams, our contact tracing, and all of us to do our part. That is why during this second surge, the need to follow provincial health orders is so important. Those are there because we know that these are situations where this virus can spread very easily now. It's not about bad people and people doing the wrong things. It's the fact that we know this virus can spread even in places where we thought it was safe with the guidelines we had in place just a few months ago. As well, we need more than ever to stay local, to stay small, and avoid public settings right now where we mix with others. They are a risk for all of us. We strongly recommend and have for some time, but I'm asking everybody in BC to consider the importance of not traveling right now unless it is essential for work or for medical care. This includes within BC and between provinces. It has been a challenge for us. We know that there is many people who want to travel, who are coming here from other provinces for recreation and sport. And we know that there are sports teams in BC that have traveled to other provinces despite the restrictions that we've put in place. And we know, for example, there's a hockey team in the interior that traveled to Alberta and has come back, and now there are dozens of people who are infected, and it has spread in the community. We need to stop right now to protect our communities and our families and our healthcare workers. This is avoidable, and these are the measures that we need to take. Making us an exception for yourself or for your team or for your recreational needs puts a crack in our wall, and we see that this virus can exploit that very easily this time of year. I do say, though, if you have a family member who's returning home for the holidays, then that is important and that is fine. But it is critical that when they come here, they need to follow all of our orders and guidelines we have in place here. And that means no socializing, no going outside the home and having parties and gatherings of any kind right now. I cannot stop you by an order and getting into your car or going onto a plane. But I'm asking in the strongest of terms for us to stay put, to stay in our communities and to protect our communities. We continue to see the impact of this virus on our communities, but on our healthcare system, and in particular on our seniors and elders in long-term care. And we all need to take a step back to stop that. The detailed, written, amended events and gatherings order is going to be posted after this session here today. And it includes the details on the orders around sport that I presented orally a few weeks ago. So just to remind people, it means that all events are prohibited until next Monday, December 7th, and we are actively looking at what we need to do in our communities to make sure that we are doing the best we can to stop transmission. So right now, events including drive-in and drive-through events, seasonal light displays, all of those important things that we would love to do right now are on pause. Exceptions, of course, are support group meetings, meals and food provided without charge to people in need, and as we've talked about, weddings, funerals, where the limit is of 10 people. In addition, the additional orders that we talked about on November 19th will be out in detail, and some of the sport details will be there as well. We've spoken about the importance of, I've spoken continuously about how important it is for us to get outside, to move, to be able to have that physical release, and I encourage everybody to go outside every day. Even for 10 minutes, go for a walk, go with your family, stick to your bubble. I will remind everybody, though, that no matter where these activities are taking place, particularly sports, there's to be no travel and no spectators. We have seen that if we maintain our distance and we're respectful to each other, we can be outside, we can go to parks, we can play games, we can make sure that we can do it safely, and we need to continue to do that. However, we do know that indoor group activities, whether it's team activities or group fitness activities, are much higher risk right now. And it's not because people are bad actors or not following guidance. The guidance that we have had in place worked for the time that we were in, but is not sufficient now. And as I've mentioned, I have a team who are looking at this and have been developing advanced guidelines based on what we have found here in BC, in Canada, and from the literature around the world. And it's apparent that it is more complex than we initially thought, but these guidance will be ready next week. And the order identifies the challenges that are the restrictions that are in place until then. In particular, we know that high-intensity fitness activity, indoor group high-intensity fitness activity is prohibited indefinitely for now, and that includes hot yoga, the spin, some of the high-intensity interval training, and others. The lower-intensity fitness, group fitness activities are on pause until the guidelines are available next week. In addition, we are putting additional restrictions on adult team sports indoors, as we are recognizing that these are indeed higher risk activities as well. What we will be focusing on is structured programs or sport for children and youth, recognizing how important those are for our young people. And we're working with Via Sport to bring those back to the level 2 Via Sport restart guidance that we have had in past. So those details will be posted later today on the PHO website. I know these restrictions put an added burden on what is an already difficult time for all of us, and it seems never ending as we're moving into December. But they are what is required right now. Despite our fatigue, we know that we can make it through this. We know that this is a road that we can travel together if we are strong and united by staying apart. We've done a lot, and you in BC have risen to this challenge. And I'm asking everybody to do a little bit more right now to protect those we are closest to protect our seniors and our elders, and to help see us through to the light that is ahead. It is our collective effort that will make the difference for all of us. And we will get through this. And we will do it as we have been, by remembering to be kind and to stay calm and to stay safe. Thank you.
Thank you very much, Dr. Henry, and I wanted to start by expressing my condolences, that of the Premier of the government, I think of the province, to the families, the friends, the caregivers of the 12 people who passed away from COVID-19 in the last 24 hours. I think we say in BC, and I think that Dr. Henry and everyone on our team tries to convey this every day. I know how we feel about it. We talk about it privately as well, that every person matters, that every case matters, that everyone with a positive test matters. And of course, the loss of people who've lost loved ones to COVID-19 matters more than all of that. It is profound and it is difficult, and I want you to know we see you, we hear you, we are with you in these difficult times, and they remind us, I think, of all of the people working in long-term care and acute care, and Dr. Henry talked about the 54 outbreaks in long-term care and the 7 in acute care. We understand the bravery and the generosity of people who work in the sector, the profound challenges for people who have family members in those circumstances. And so when, as Dr. Henry did today, we announced 3 new outbreaks, 2 in acute care and 1 in long-term care, and 5 outbreaks over, we hear the powerful sigh of relief from those who are in the latter category, who've had outbreaks declared over, and the anxiety that everyone involved in outbreaks feels. This week has been Monday and Tuesday and Wednesday, an extraordinarily difficult week for everyone involved in this. And it should remind all of us, I think, of what we have to do together right here and right now in this period before the prospects of a vaccine come, to help protect one another and protect our communities from COVID-19. I'd also like to just bring you up to date on the contact tracing recruitment initiative, which we do on Thursdays. This week alone, we've added 161 positions. To date, 1,096 individuals have been hired, more than the 500 initially announced in August and the 608 announced in September. We intend to bring this total to over 1,200 positions. I reported last week that we've added some support from Statistics Canada, 70 people, and that the BC CDC is actively working with the Red Cross and anticipate that they will bring volunteers and staff to support logistics and running the operational center for the PHSA BC CDC's regional contact tracing hub at the Vancouver Convention Centre. The First Nations Health Authority has been approved to hire 76 community health representative positions to support culturally safe contact tracing. There are also 382 candidates at the interview stage for further positions and 113 in the offer process. We would like to thank everybody who stepped up and everyone involved in this initiative, which truly is extraordinary. And finally, I'd just like to note, to talk about seniors care, that under our plan to increase resources in seniors care, 1,000 people have been hired. But we want to be very clear about one thing. When you have 54 outbreaks in long-term care, that affects workers too. And that puts challenges on long-term care communities. And so we are continuing in every way to seek the resources necessary to support long-term care, those care homes that are currently in outbreak and those that are not. And we will continue to do so. I just want to say in conclusion that I think this is a moment. Just one more thing before I say that I will have something to say tomorrow with respect to the recommendations presented to me by the Deputy Minister Stephen Brown with respect to PHSA expenses, which some of you may want to ask about today. Finally, I just want to say that this is really the time to dig in for all of us. The orders that Dr. Henry put in place now a couple of weeks ago, those orders, I think, have been overwhelmingly respected. But again, we cannot and we must not attempt to litigate to try and push to the far edges of those orders. We need to come together now and follow them and work with them and work within each other and protect one each other, which means no gatherings outside of your immediate household at home. It means no gatherings, basically, period, outside of the homes, because these are places where we see the transmission of COVID-19. And right now, here and now, in November, or should I say in December, is when the virus is transmitting itself and is the most dangerous. What was possible in August is not possible now. And no amount of arguing or litigating will change that. I so appreciate and admire people in British Columbia and faith communities and the community as a whole who have done extraordinary things during this COVID-19 pandemic. This has been an unbelievable and difficult year. And I think people in British Columbia, our healthcare workers, our essential workers, our communities, people in education, people everywhere have done extraordinary things. I think of the people who staff our grocery stores. And for all of them, for all of those that you love, for all of those that you don't know, now is the time. Now is the time to dig in, to follow the instructions, the orders, the guidance that have been put in place. And if we do that together, we can get through this extraordinary period, not without losses, but with less losses than we would have otherwise. And that, I think, is a profound goal of all of us The losses in the last week have been considerable. I want you to know they affect everybody involved in this. But we have to, right now, find the energy and the support and the love to do what is necessary to support one another in difficult times. Thank you very much.